Bunkers, and I'm a family medicine physician. We have a lot of different titles in Mayo, but one of my titles is the CEO of the Faribault area. And so it really has been a great pleasure to work with all kinds of different folks in our Faribault community. Our provider staff here, our chamber colleagues, Dr. Rucci and his team here at Crossroads Medical Center. And I think today is, well, this is our ribbon cutting for actually 3 new services that we have been able to bring to the community. Occupational medicine, again, when we went and visited with different employers, not just from Faribault, but from Owatonna and the surrounding region, they really wanted a dedicated occupational medicine center. Where do we send our employees who get hurt on the job, or who need a DOT exam, or any of those sorts of things? And so that is one of the things that we are doing here now. Cooper Riston is our physician's assistant who provides that service. The other thing we heard from the community was we need a less expensive way of delivering healthcare. And we see that popping up across the country in what's called a retail clinic, where it's not a full scope, but for common illnesses like strep throat or ear infection or urinary tract infection, you can come in, you can get treated by a healthcare professional, and it's a lower cost than going to a regular clinic. And so that's the Mayo brand for that is called Express Care. And so we have Michelle Chip, who is one of our providers, who provides that service. And then the third piece is our sleep services. So obstructive sleep apnea is a growing disease, and there are other sleep-related disorders. And so we have designated this as kind of our regional sleep center. So we're sending patients from other parts of our region to come here and to get that care. All of that, I think, demonstrates, and I hope demonstrates to those of you who live here in Faribault, that Mayo is very, very committed to this community. Very committed. And expect to hear another announcement within the next couple of months about our ongoing activity in this community. But we take great pride, we take feel a great deal of responsibility for caring for this community and for the people who live here. And one of the things you're going to see in medicine as we go forward is that we're working more in teams, and we're also trying to identify areas where we can consolidate. So express care, occupational medicine, and sleep are what we're here to celebrate today. So my boss is Dr. Dave Agater, who is our regional CEO. Dave, do you have anything you would add to that?
Well, thanks, Brian. I think you've given a very nice comments. First of all, I thank you for coming here today. I'm also a family physician. I'd like to introduce Dr. Boso. One of the interesting things, I was part of the faculty that helped train Dr. Boso. So it's really an honor that to have him take a leadership role for occupational medicine in our region. Mayo feels it's a privilege to be in your community and have a presence. And we're trying to learn from you how best to meet your needs in the community. And I think Dr. Bunkers has spoken to that. There's a need to have that same-day access for patients who have certain types of conditions. I just had a chance to meet the staff here. They're doing a wonderful job. An occupational medicine program on a kind of a regional basis, and we're listening to the employers within our respective communities to better meet their needs as well, and help provide that in truly a more cost-effective manner as well. And I think the sleep center is a bit of innovation. To have that here, to me, it would be exciting to measure how patients meets their needs rather than having to travel all the way to Rochester. That is linked directly with Rochester, which has a world-class sleep center. You're going to get that same evaluation here in your home rather than traveling all the way over there. And I think it speaks of what we're trying to do, coming together with an integrated healthcare system. So when you go in there, you have the same electronic medical record that you're going to have in the main campus in Rochester. And soon it'll be the same electronic medical record in Arizona, Florida, or Rochester. And so we truly, and as an organization, it speaks to our values, the needs of the patient. So I think this is just in many ways the beginning. Again, I'll end with